It's a bit embarrassing, but ever since I gave birth, whenever I cough or sneeze, there's urine leaking out. I don't know where to seek help or what to do about it.
So actually, there's nothing to be embarrassed about. So urinary leakage is actually very common, especially for women who gave birth. So I think you've come to the right place. Physios are actually well trained to treat problems related to pelvic health issues. So I think we are there to help.
Before we dive into the exercises that you can do, it is good to go through some of the basic anatomy involved so that you can have a better understanding of what you will be training in your body. Here you can see a model of the female pelvis. There are three main organs involved that have three respective openings that go through the pelvic floor. First is the bladder that leads to the urethra where urine comes out. Second is the vaginal wall that leads to the vaginal opening. Third is the rectum, the end of the large intestine which leads to the anus. What supports and surrounds the organs and their respective openings is the pelvic floor, which is comprised of a thin sheet of muscle that stretches across the entire pelvis. Other smaller muscles include the anal and urethral sphincter, which constrict the anal and urethral opening respectively. Dysfunctions in the muscles mentioned could lead to issues such as anal, or in this case, urinary incontinence. Now we'll be first instructing you how to perform pelvic floor exercises, first in easier positions. For easier pelvic floor muscle activation, position your pelvis in a gravity-eliminated position. Being in crooked lying with pillows under the pelvis would be the easiest via increased gravity to assist the elevation of the pelvic floor. Position yourself on a plinth or mat facing the ceiling and with both knees bent. Tighten and draw in and up around the anus and urethra, pulling up the pelvic floor. Hold as long as possible whilst keeping breathing. You may place your hand at your mouth to feel for your own breath. You should not feel your abdominal, thighs, or muscles at the buttocks contracting. These muscles should be done daily. Depending on slow or fast twitch muscles, hold for 5 seconds for slow twitch muscle activation, slowly relax and rest for 10 to 20 seconds. For fast twitch activation, pull the pelvic floor up, hold for 1 second, then relax. Perform this exercise at a minimum of 30 to 45 repetitions a day. To progress the exercise, remove the pillow underneath your pelvis. Straightening both knees also adds a challenge. You may also contract at a longer time, such as 10 seconds, depending on your subjective feeling. When you can contract your pelvic floor muscles with ease, try training on a chair. Whilst training on a chair, position your urethra against the chair and contract your pelvic floor muscles. You should be able to feel as if your urethra has been lifted off from the chair slightly. This exercise can also be progressed into standing, or be performed on a football, both adding more challenge to the core and pelvic floor muscles. In addition to pelvic floor muscle strengthening, other exercises such as the clamshell exercise and the adduction exercise should be done as adjuncts to pelvic floor muscle training too. Adjunct devices such as the vaginal cone or beads can also be used to help pelvic floor muscle contraction. Do consult a physician or a therapist prior to usage of such devices.
Okay, so here are a few lifestyles and behavioral modifications to tackle your stress urinary incontinence problem. So firstly, maintaining your proper personal hygiene, like changing your clothes daily. Secondly, adequate fluid intake. Thirdly, avoid caffeine, alcohol, smoking, or any sedentary lifestyle. So try to maintain a healthy lifestyle. Proper weight management with regular exercise, and intake more dietary fibers to alleviate the constipation you have.